Now, to continue with our discussion, we are now bound to tackle about understanding the chemistry of lust, attraction, and attachment. Helen Fisher of Rutgers University identified three stages of love. These are lust, attraction, and attachment. Lust, libido, or sex drive is characterized by the desire for sexual gratification, which is inherent to every living organism. For humans, this is associated with the sex hormones, testosterone for males and estrogen for females. So, literally, it is just about the surge of the sexual hormones in the body, leading for the person to experience that sex drive. So, with that, one could engage in one night stand or just to get through the night kind of experience. Now, second form of or stage of love is attraction, which is the passionate or the obsessive kind of love, or it may include infatuation. It is characterized by the intense attention given to a desired partner. So when you have a crush on someone, or if you have been making another individual as a subject of your passionate love, then that could be an example of attraction. A person who craves for emotional union with a person has a high degree of attraction. So when you could be thinking so much about the person, it doesn't really follow that you are romantically involved with the person, but if you are thinking about that person and you have that emotional desire to be in union with that individual, then that could be part of the attraction stage. And this stage is driven by chemicals and hormones like adrenaline. So, adrenaline is released in the body for fight or flight scenarios or responses. Like, for instance, after surprisingly meeting one's object of affection, this hormone will activate one's stress response, such as sweating and drying of the mouth. So that could be described as the meme experience of most individuals who could not also move, who could not understand themselves whenever the person is just near to them or the object of affection is around them. Second hormone or chemical released is the dopamine. It ignites an intense rush of pleasure when released. So high level of neurotransmitter like dopamine causes increased energy. There is less need for food and sleep and focused attention to one's desired partner. So this is when your day, you could say that your day has been made. This is when one becomes so happy after seeing the other or the object of affection that it could be enough for one not to eat, or there is that increased energy, like there could be springs under that person's feet, and experiences that may describe delight, excitement whenever the person of affection is being seen and come in contact with. The third um, chemical or hormone is serotonin. It is attributed to falling in love, as this hormone makes a person think of his or her desired partner at most times. So these are the different chemicals and hormones being released when a person would be attracted to someone. It could be physical attraction, or it could also include emotional attachment. to the person. Now, talking about attachment or companionate love, it is characterized by the desire of couples to stay together. A person who is already attached feels comfort and security from his or her partner, and this phase also includes behaviors anchored on long term companionship. This stage is driven by two major hormones, namely oxytocin and vasopressin. Oxytocin or oxytocin is a cuddle hormone that is released during orgasm. The feeling, it is also attributed to the feeling of attachment, which becomes more intense after the couple has done sexual intercourse. And vasopressin, on the other hand, is an antidiuretic hormone which is released after sexual intercourse. Scientists discovered that the role on vasopressin in attachment by studying little mice. It could form monogamous bonds like humans. So these, when the female or the female kind of the, these little mice would be neglected by the male mice if they are being injected with vasopressin. Now, talking about what turns people on and off. A turn on refers to something that someone may find desirable, pleasant, beautiful, likable, or any other positive quality. A turn off, on the other hand, is the complete opposite. Turns on, turn ons and turn offs usually refer to another person's physical traits, attributes, attitudes, and conduct that one may find desirable or not. A person may be turned on if he or she finds a particular quality of another person's desirable attribute. Otherwise, he or she may be turned off. For teens, turn ons and turn offs may focus on the physical attributes and personal qualities of someone from the opposite sex. A teenage girl, for instance, may find a boy or a boy's charming smile as a turn on, while bad posture may be a turn off. A teenage boy, on the other hand, may find a girl's dimples a turn on, while tattoos may be a big turn off. For young adults and mature adults, turn ons and turn offs may be associated with sexual activities. Sexual stimulation is often a turn on, for it is part of the sexual activity. Turn ons may also be the sexual acts that one finds desirable and pleasurable, and turn offs may be those acts that are disagreeable. Turn ons and turn offs also signal sexual responses during sexual activities. So, what turns people on and off are qualities and acts that people observe and experience. It can be different things that one comes in contact with constantly. An individual's turn ons and turn offs can simply serve as markers of one's personality and identity. Now let's go to the discussion of diversity of sexual behaviors. Sexual behavior or activities may come in the form of masturbation, premarital sex, marital sex, extramarital sex, heterosexuality, homosexuality, and bisexuality. Now, masturbation. It is a sexual act of stimulating one's own genitals done alone by the individual. Both men and women masturbate, although some studies say that men do the act more often than women do. But in the case of individuals who have now permanent partners who are already married. Masturbation, too, in some cultures might actually be perceived as a form of immaturity because they have their partners and it is like a sign of compulsive masturbation as considered to be a problem because the person already has a partner to where sexual contact could actually be possible. Now, premarital sex refers to the sexual activities people engage in outside of marriage. For certain religions, it is considered to be unacceptable, for there is a belief that it is only through marriage that man and woman could partake in sexual activity. Now, moving on to marital sex, these are sexual activities that happen within the bounds of marriage, and sexual activities within marriage are accepted for marriage is perceived to be a legal and symbolic binding of two people who agree to only to be with each other. But mind you, in the bounds of our own law, marital sex may be an act of binding with two individuals, basically married couple, who consensually agreed to do such act. But when a partner would be doing it enforceably or forcibly, then that could be something else. That could be a violation of a certain law, meaning you cannot just easily say that your partner should submit to your whims, to your sexual desire in any way at any time you want it to happen. Meaning there should be that approval from your partner. Nevertheless, you would also be facing some legal consequences if your partner would not allow or consider it as a form of marital rape. Extramarital sex is the seeking of sexual pleasure and performance of sexual activities that married people engage in with people they are not married to. Extramarital sex happens among people who engage in extramarital affairs, and this is considered to be unlawful and unacceptable in society, for it is a practice of infidelity. Now, moving on to heterosexuality, it is a sexual behavior. Heterosexuality happens between persons of the opposite sex. On the other hand, homosexuality is a sexual attraction and activities that happen between two people of the same sex. So it could be MSM, or male having sex with males, or it could be females who are also attracted and having the sexual attraction toward other females. Now, bisexuality refers to a sexual behavior of one who engages in sexual acts with someone from the opposite or same sex. Now, let us take this part to talk about sexually transmitted diseases, or some would say the consequences of sexual choices. Now, you might actually be reading some texts talking about STIs and not STDs. Now, the difference between the two terms is that sexual sexually transmitted infection could be just a form of infection and it may not lead to a disease. But STD, or sexually transmitted diseases, refer to health conditions that are passed on from a person to another through sexual contact. So it is already a disease. There are already physiological manifestations of the problem, and it has been ongoing. STDs can be contracted through having unprotected sex with someone who has an STD. So, an example is HIV or AIDS, or the human immunodeficiency virus, or AIDS, which is also the acquired immune deficiency syndrome. It is a spectrum of conditions caused by being infected with the human immunodeficiency virus, and it is primarily transmitted through unprotected sex, contaminated needle exchange, and blood transfusion, and even during pregnancy. AIDS refers to the occurrence of the specific diseases due to the contraction of HIV. Second sexually transmitted disease is the gonorrhea. It is a bacterial infection of the mucous membranes, including the eye, the throat, the genitals, and other organs. Usual symptoms in men include secretion of the yellowish white fluid from the penis and painful urination. For women, they may experience painful urination with discharge, accompanied by fever, abdominal pain, and pelvic inflammatory diseases. Now, a third example of an STD is syphilis. It is an infection caused by the corkscrew-shaped bacterium called the Treponema pallidum that is transmitted through direct contact with a syphilitic sore on the skin. So it may cause sores in the vagina, the anus, the rectum, even on the lips and the mouth. Syphilis is transmitted not only through sexual activity but also by merely kissing an infected person. Syphilis may lead to paralysis, crippling, blindness, heart disease, brain and organ damage, dementia, and even death. So another example of an STD is the genital herpes. It is a viral infection that causes blisters on the genitals, and it also causes itching, like a burning sensation on the skin. And unfortunately, there is no cure for genital herpes, but there are medications to reduce its severity and the frequency of the outbreaks. Another example is also the genital warts. These are warts caused by the human papilloma virus, or HPV, that grows in the genital or the anal area. Now, another example of an STD is the Conkroid. It is a bacterial infection that causes sores or ulcers on the genitals. So these Conkroid sores usually appear at the head of the penis for men and on the labia majora for women. Another example is the pubic lice, or commonly known as crabs. These are very small parasites that infest the genital area, which are primarily spread through sexual contact. The parasites are attached to the pubic hair and may even be transmitted with contaminated clothes, bedding, and other items. Scabies is another example of an STD. It is a skin condition that is caused by infestation of tiny mites called Sarcoptes scabiei, and symptoms of the mite invasion include itching and rashes. Similar to other mites, they lay and hatch egg in the human skin, and it is usually transmitted through sexual intercourse and close body contact. These mites cannot jump or fly, but sharing of clothes and other washable items may also lead to their transmission. So we need to be cautious in using other people's clothes and getting physically physically in contact with them. Trichomoniasis is another example of an STD. It is an infection caused by a parasite called Trichomonas vaginalis. Men infected with trichomoniasis may experience itching, genital irritation with discharge, and painful urination and ejaculation. Women infected with trichomoniasis may also feel itching, genital soreness and irritation, painful urination with unusual discharge that can be yellowish or greenish in color. Now, molluscum contagiosum is another sexually transmitted disease. It's another sexual um, sexually transmitted infection caused by the molluscum contagiosum virus. It is a skin condition characterized by small lumps, which are uh, purely white or slightly pink. These lumps, when squeezed, release a white, cheesy fluid, and the virus can be transmitted also through skin to skin contact and through sharing of clothes and other personal things. Now, we need to also be reminded that the pelvic inflammatory disease is not a sexually transmitted infection, but it is a complication resulting from STIs or sexually transmitted infections, especially chlamydia and gonorrhea. Women infected with PID experience inflammation of the uterus, the ovaries, and the fallopian tubes, and the disease is caused by bacteria, a fungi, or the parasites. Chlamydia, as a sexually transmitted infection, is caused by the bacteria Chlamydia trachomatis that do significant damage to the human reproductive system. Chlamydia can infect the penis, the vagina, the cervix, anus, urethra, the eyes, and the throat. Females infected with chlamydia suffer vaginal discharge with strong smell, difficulty in urinating, and pain during sexual intercourse. Males infected with chlamydia experience discharge from the penis, difficulty urinating, and swelling in the testicles. So let us remember that STDs are prevalent among individuals who engage in unprotected sex with multiple partners. Irresponsible sexual behavior often result in dire consequences that have significant impact on people's lives and futures. So aside from health risks, STIs may also ruin relationships, a creative or they create a negative stigma against the person and risk other aspects of one's social life. So it is important that everyone makes responsible decisions with regard to sexuality and sexual behavior. Responsible sexual behavior entails respect for one's body. So it means we need to take care of our own body and avoid activities that undermine our worth and respect. We also have to be mature in our thoughts and our deeds. We need to be objective, rational, and calm instead of being swept by our emotions. So we should be guided by our personal beliefs and core values. So everyone, especially adolescents, should always be grounded by his or her personal principles and self-worth. And we should also be future-oriented. So instead of focusing on the present, a person should also weigh his or her present actions with possible consequences in the future. So sexual pleasure might be overwhelming at the moment, but always focus on what it will entail in the future. So, what could be the possible consequences of our behavior later on if we will continue also irresponsible sexual behavior? So, let's go now to the methods of contraception. So, since there is no perfect method of contraception, one must take into consideration the following factors in choosing a particular method of contraception. One, it should be safe enough. There should be no unwanted side effect for every individual using the contraceptive. Second, it should be efficient in averting unwanted pregnancy. Third, it should be simple and easy to use. And fourth, it should be available at any given time. Now, some of the recognized methods in family planning are the folk method, or the post. An example is the postcoital douche or douching. Douching is a method used by women to flush out the vagina with a medicinal solution to remove or destroy the sperm. And after sexual activity, the woman will immediately apply the solution, and the solution could be water, vinegar, and other commercially available products. However, this is relatively ineffective because the sperm enters into the cervical canal within 2 minutes after ejaculation, and such access may occur before the seminal fluid can be washed off from the vagina. Doctors claim that frequent douching may affect the natural mucus of the vagina. It may cause the vagina to get dry, no? And moreover, women find it inconvenient to douche right after intercourse. Now, another example of the folk method is prolonged lactation. This technique used by women is done through breastfeeding their baby for a longer period. And prolonged lactation, according to doctors, helps delay ovulation. Okay. Second method of contraception may be familiar to us. These are the behavioral contraceptives. So, behavioral contraceptives do not need any artificial devices, and pregnancy can be prevented by altering the natural process of sexual relations, thus impeding the union of the egg and the sperm cells. However, such methods require a high degree of motivation for partner or couples to become successful. So it needs the participation of both individuals in a relationship. So an example of which is the rhythm method. The rhythm method is a natural method supported by the Catholic Church. Couples are enjoined to abstain for a certain period while the woman is fertile. A greater degree of reliability may be obtained if the woman will keep track of her body temperature every morning. And during the menstrual cycle, the highest recorded body temperature is the time that the woman is most fertile. So it tells us that if a woman is fertile at the time, so there should not be any sexual intercourse that will happen. Ovulation method is another example, and this practice makes use of the observed mucus discharge from the vagina at the beginning of a woman's fertile period. After menstruation, a woman experiences that feeling of dryness in the genital area, and these days are safe. But when the woman feels that she is no longer dry, this means that there is a mucus discharge from the vagina, which normally appears 3 days after menstruation, which is a sign that ovulation will take place. And sometimes the woman may only feel the wetness but not actually see it. So the mucus initially appears as a sticky yellow thread-like substance in very small quantities. Later on, it becomes thinner, clearer, stretchy, more copious, assuming the appearance of the raw egg white and having a slippery texture as that of a lubricant. So this is a sign that an approaching ovulation is about to happen, and all the wet days or mucus days are unsafe days. So meaning sexual intercourse should not be done. All days thereafter are safe, whether feeling dry or wet, until the start of the next menstruation. Therefore, before ovulation, as long as there is mucus discharge, it is unsafe to have sexual intercourse. And this is because the mucus is necessary for the survival of the sperm cells, as it nourishes the semen inside the woman's body from 3 to 5 days. Another example of the behavioral contraceptive is the withdrawal or the coitus interruptus. So this is the process wherein the man, during sexual intercourse, withdraws the penis out of the vagina before orgasm. And another example of behavioral contraception is the coitus reservatus. So a practice which the man withholds ejaculation and let the erection subside in the vagina. So they just wait for the erection to subside in the vagina rather than ejaculate inside the vagina. And remember, there are other behavioral contraceptive methods such as oral or anal sex, but these are considered forms of perversion. So let's now go to mechanical contraceptives. So mechanical contraceptives could be in different forms that act as barriers to prevent the sperm from entering the uterus, thereby preventing pregnancy. And then a popular example is the condom. A condom is a thin material made of rubber used during sexual activity. The man wears the condom on his penis to prevent the sperm from entering the vagina. And most doctors usually recommend the use of condom to men who are sexually active to prevent the spread of sexually transmitted diseases. A diaphragm is also another example of a mechanical contraceptive, and this is a shallow rubber cup rubber cup inserted into the vagina. The diaphragm is coated with spermicidal cream or jelly to prevent the entry of the sperm into the uterus. And after intercourse, the diaphragm should not be removed for at least 8 hours. The diaphragm can be inserted by the woman alone without any assistance. Another example of a mechanical contraceptive is or are the cervical caps. These are fitted over the cervix by a doctor, and usually cervical caps can be worn for a month starting after menstruation up to the onset of the next menstruation. Now we also have chemical contraceptives. These are better known as spermicides that are used to prevent pregnancy by stopping the sperm from entering the uterus. An example of which is the vaginal suppositories and tablets. So a suppository is a small bullet-shaped dosage that they contain chemicals used in destroying the sperm cells. It is inserted into the vagina to melt before sexual intercourse. So these are the vaginal suppositories and tablets. And then we also have contraceptive jellies, creams, and vaginal foams. These are applied onto the vagina shortly before sexual intercourse, and these vaginal foams are packaged with butane propellant in a bottle or are sold with plastic applicators. So these are spermicides immobilizing and killing the sperms. They are effective for an hour as long as the vagina will not be douched or washed 6 hours after intercourse. And according to some doctors, the most effective spermicide is the vaginal foam. The vaginal foam effectively covers the wall of the vagina with a thick film of foam to prevent the sperm from entering the uterus. Now, another method of contraception could be IUDs in forms of IUDs or intrauterine device. It is a small device of polyethylene plastic or a thin copper wire inserted into the uterus by a physician. IUD includes the coil, the loop, and the Cooper T that are used to avoid pregnancy. And IUD has a nylon trail which can be felt at the cervical opening. Another method could be pills, and taking the pill is completely dissociated from the sexual act. The pill renders the woman infertile, and she does not need to think about pregnancy. When taken exactly as prescribed, the pill is almost 100% effective, and the pill contains hormones which prevent conception by inhibiting the ovaries from releasing the egg cells. The development of the oral contraceptive pill is viewed as another modern medical miracle. In contemporary society, where there is a tendency to regard drugs as a panacea for everything from insomnia, headache, to even boredom, it would be wise for a woman to remember that even medical miracles have their drawbacks. Oral contraceptives are powerful and effective drugs, but they have side effects on some users and should not be used at all by some women. So it is important that you need to also consult a doctor so that you will not also be suffering some side effects or some repercussions when taking pills. Now we also have sterilization, or a surgery that is done when comparative at a comparative ease and is virtually 100% effective. Sterilization of the male is achieved through through vasectomy, and sterilization of the female is through tubal ligation. Vasectomy is a relatively simple procedure in which the vas deferens, the tube through which sperms are transported, is tied off or cauterized, causing the sperm to be reabsorbed by the body instead of becoming part of the semen. On the other hand, tubal ligation is a major surgical procedure in which the woman is put under general anesthesia and a large abdominal incision is made and the fallopian tubes are cut and tied off. Ovulation and menstruation continue as usual, but the ripened egg can no longer enter the uterus. Instead, it disintegrates and is absorbed by the body. Now, lastly, an example of contraception are injectables. These are one of the latest forms of contraceptions, and this contraceptive is injected in a woman to inhibit ovulation. An injection usually lasts for about 3 months.